Welcome to the Hybrid Therapist Podcast with your hosts, Andrew Wild and Andrew Iliev. Welcome back, mate. It's been a 5-week stint out.
Mm-hmm.
We're back. You were sick last week. How are you?
Mm-hmm. I'm better. We're good. Flying. Purple shirt on today. Feeling good.
Why the purple shirt?
It is the month for Parkinson's and brain cancer, and they wear purple. So we donate 1% of all our takings to charities surrounding that.
Nice.
And we wear
Great.
purple as like people go exactly like you do. Why are you wearing purple today?
Yeah. It's a conversation starter.
Yeah. We got weird colors too. We got some shockers that we wear, but I'll tell you what, it gets people talking, and that's what it's all about.
Yeah. At least it brings it to their front of mind, that
Yeah.
that cause, it makes sense. That's good. Good on you.
How you been?
Pretty good. All's well. Did a podcast with Tom Cross yesterday about
Oh
the cross
yeah.
protocol, which was good. I don't know whether you've listened yet, but it
Not
was a
yet.
it was a fascinating discussion. And I went into the clinic yesterday after it with one of my footy players that had done his ACL on Wednesday, and he's
Mm.
not a candidate for the bracing protocol, so he's got a surgical opinion or consult next week.
And just why isn't he like? What's the basis of not being a candidate?
He's not a candidate because not enough of the ACL, the ends of the ACL, are
Mm-hmm.
close enough together. So it's about 60% of the ACL is close enough together, but 40% of it's flipped and it's
Yeah.
been thrown too far away from the other end or the other stump.
Yeah.
So he's not. Look, if you put him into a brace and the bracing protocol, he would probably heal about 60% of the ACL, but
Mm-hmm.
it'd have a sag,
Yeah.
and also there just wouldn't be enough thickness to the ACL. So
Yeah.
Tom made the decision yesterday that he's a surgical candidate. So he's seeing Dr. Ben Gooden next Wednesday to discuss the options where we go from
Interesting.
here. And Tom said that, look, in the future, maybe we'll get to the point where there'll be surgeons that are able to go in and get that piece of or a little bit of the ACL that's been thrown
Mm-hmm.
and get it back into a more anatomical alignment, so it's closer
Yep.
to the other end that's been
Yep.
ruptured. So then, ideally, what we want is them to be close enough so they can then heal. But yeah, it doesn't look like he's a candidate, so he's going the
Interesting.
surgical route. But who knows? In the future, the surgeons might
Get
be able to
that.
go in, and I don't know whether you know much about the bear procedure, but they might be able to go in and move that section of the ACL that has been thrown and get
Mm.
it up in more of alignment, and then brace rather than going
Interesting.
in for the surgical intervention. So we'll see. Check this space. So
Mm. And for
Tom and
listeners as well, that what you're talking about is retraction of the fibers is often what it comes up on scan, isn't it? So if they're looking for whether or not they're a candidate, if they've got a large amount of retraction or they're documenting that, it's probably best not even sending them to someone like Tom if you're
yeah,
seeing that on scan straight away, right?
yeah. If on the scan there is a big displacement by
Mm.
of the two ends, and it's nowhere near, and it's above that sort of 6 millimeters away, it may not be a candidate. But
Yep.
I think the problem with it is because it is so novel and new, that I still think a consult is worthwhile because there's a classification system that's getting written at the moment that Tom's doing about classifying ACL injuries. So some of
Yep.
the radiologists out there might not be all over the new classification system. So
Yep.
the radiologists that are working closely with Tom are all over this, and
Yeah.
so they have 369 patients now in the cross bracing protocol
Wow.
over the last 8 to 9 years. And so they have all this data and they know what to look for.
Yeah.
So I still think that it's worthwhile having a
So,
consult with
yeah.
with Tom,
Fair.
because you never know, you might be a candidate, and if you're not,
Yeah.
well, you've got the options of going down the surgical route going forwards. But it'd
Yep.
be interesting to see whether there's a repair option where the bit of the ACL that's been thrown, if are
Mm.
we able to put it back in anatomical alignment, and then from there
Yep.
we're reducing how many surgeries are needed going forward. But yeah, watch this space, and
Yeah,
Tom and I'll
interesting.
continue to do some podcasts on this topic going
Mm.
forward. It's a controversial topic, but at the same
It
time, I
is.
think it's a good alternative for a lot of people. And as he discussed yesterday, there's so much use for this in third world countries, places that don't have access to MRI, don't have
Hmm.
access to medical equipment and surgery and that sort of stuff. So, even in Fiji, because about 50% of ACL ruptures look like they may be a candidate for the cross bracing protocol. So if they can't
Mm.
afford it, well, if you braced
Yeah.
every single ACL, well,
Yeah.
half of them are going to heal
Yeah.
potentially, and then even more will potentially heal without as optimal result as
Mm.
the other 50%. But still, you might get some healing. And Stephanie Philbay's Canoon trial showed that about 50% of all ACLs showed some degree of healing. So
Yeah.
it's an interesting space, man. It's moving so
Yeah.
fast, and
It is. It's
that
probably it's good. At least we're moving away from surgery as our only option anyway.
yes, yeah.
So, and I suppose for many of us, how many of us have we seen that go, oh, fuck, why did they bother having the surgery? But now at least people do have a legitimate option that's been researched, and is currently being researched.
Yeah. And if you want more information about that, the podcast episode got released yesterday on my Wild Physio podcast.
Nice.
So have a listen to that.
Excellent. Yeah, I
But
will.
today we're going to touch on taping. Bit of a
Mm.
boring topic, but at the same time, some people have reached out and asked us to cover it. And I
Yeah.
suppose the first thing that we'd probably go through is maybe let's get through the kinesiotape and the fact that according to the research, kinesiotape is not doing anything in terms of any structural change. We're
Yeah.
not seeing any physiological change. Look, some people might get some temporary relief. What are your thoughts on kinesiotape?
I think, look, I was first introduced to kinesiotape 15 years ago, I think, or even I can't remember, but as a student working at, or not just working, but during our placement at Sydney Kids Hospital, where it was just released, or they were using it for cancer patients. So it was part of lymph drainage, and so I think kinesiotape from that point of view was all about getting those water, I don't know, watersheds moving and things like that. I don't think it was ever meant to make its way into the sporting world, but I think the colors and the marketing took it down a path. I've never really used it for anyone. I mean, we've got some here at clinic, but I think it's more just because it looks pretty and it's the thing to do, that there's maybe one or two rolls sitting in the drawer somewhere.
Yeah, it became popular. I think the 2012 Olympics in London, a
Mm.
lot of the athletes were using it, and they're pink and blues and black
You'd have the
colors, and they're
flags of
cool.
the countries on there.
Yeah, yeah, it looks cool. And, it
Yeah.
was much like in 2016 when Michael Phelps swam in his last Olympics and he had all the cupping marks on his
Yeah.
shoulder and his back, and so many people coming in and being like, "Oh, do you do cupping? Can I do cupping?" And anyway, it's interesting because the popular culture, if you've got athletes on TV wearing kinesio tape, then people want to use kinesio tape themselves. But
Mm.
look, if its effectiveness in terms of, as I said before, there's no change. Some people get some temporary relief if they put it on, but you probably do the same thing if you put a band-aid on them.
I think that's
um,
what it is, right?
yeah,
It
it's
make
just
you
it's sitting on the skin. Like we're
correct.
not seeing any, like it's different, say, for instance, with ankle strapping or something like that. We're trying to actually give the ankle a little bit of rigidity.
Yeah.
Um,
And look, is there a use for neurofeedback and that sort of thing? Potentially just having that, constant touch on the skin. Potentially.
yeah,
Do I use it like that? No, but I'm not going to at the same time discredit it. If you maybe got a low back and you're just sort of thinking, oh, I'm going to put some along the rectus spinae. Look, if it makes the patient or client feel better, and it gets them able to do their exercises
yeah,
and actually work their way out, then look, it could be an effective thing. We don't use it for that in clinic.
yeah. You know what
Um,
I often use it for, because I do have some in my sports bags and stuff that I take to games, and I
mm.
have some at the clinic because it's got that little bit of stretch to it. It's not actually a bad underwrap, and it's
Oh
quite
yeah,
sticky,
yeah,
and
yeah,
it's
yeah.
quite sticky. So sometimes for a guy or girl that doesn't like a rigid tape or any other type of tape around their shoulder when you're doing a shoulder strapping and you're doing your anchor around their humerus,
Yeah.
I have sometimes used that as an anchor instead of something else,
Yeah, so
just
that's
because of
actually not a
the
bad use.
yeah, because
I
it's got
know
that stretch to it.
yeah, I used to use it when I'd wrap the union players' heads, the ears
Oh
in,
yeah, yeah,
and I didn't have any of the white elastic band stuff, and I'd run out some days, and you're off in your kit, and you just get the K tape and ring it round, and then use it maybe for the forwards as they're getting lifted. You'd put it around their quads, but it wasn't a mechanical. You weren't using it for a mechanical reason.
Yeah, and obviously people have been doing McConnell taping for years, and that's often
Yeah,
done with a rigid tape. And sometimes in the past, I've used kinesiotape for more of your McConnell type of taping with your more medial glide of the
yeah,
patella. And the good thing about the K tape, it's got that little bit of give to it. So as
yeah,
the patient bends down or squats down or kneels down, because of the give, the tape doesn't peel off the skin.
yeah,
So again, structurally we changing things, no. But I think that is potentially another use for it around that knee area. I typically what I do with the footballers, because you can't just put K tape on the front of a knee and then just
mm.
expect it's going to stay on during the game. If
Yeah,
someone likes that, I'll put the K tape on and do a little medial glide, and often their knee feels a little bit better.
yeah,
Um, and then I'll use elastic adhesive bandage around that, and
yeah,
I'll go from lateral to medial, and then just wrap it round from above the knee to below
yeah,
the knee, just so it stays on.
yeah, yeah.
Something like that. That's another use. But look, I haven't used it on necks, backs, shoulders,
No,
muscle injuries ever.
no.
I can't think of any other time other than those that I've mentioned that I've used it.
Yeah, I think you're probably spot on there. I mean, we'd be much the same. Um, I just think back to probably the first time I ever remember seeing it on a rugby league player was on Jared Hayne,
Yeah.
and we all know how that's happened. So that's worked out.
Yep. We won't delve into
No,
that. But yeah, no, I hear it's definitely just one of those things back about a decade ago that just went
yeah,
boom because of the
viral.
fact that people were seeing it on TV,
Yeah, exactly
And
right.
there were even like when we first came out of uni, end of 2011 we finished, and 2012 that was the Olympic year, and
Yep,
I remember getting the in motion from the APA. So it's the Australian Physio
yep,
Association magazine that comes out every month. And in there were courses to learn how to K tape.
yep.
And I remember them being like $800 or something like that for a weekend. And I'm like, wasn't using it at the time. And I just thought, "Hey, this is ridiculous." And I was right at the time. Some of my colleagues were using it. And I was like, the research will come out and show that this is not
Yeah.
effective.
Well, I mean, it sort of then leads us into taping anyway, right? Like, is taping really effective?
We're talking rigid taping
Even
now.
rigid taping, is it actually effective? Like, we just did a brief little look on some research, before we started this. We're just sort of both tapping away. Was is Did you find much in
I
your?
Yeah, look, I'd have to delve further into the research. It's funny we are even talking about this. So at university, I forget what subject it was, but I think it was third year. I did a research study of my own, and I think it was an assignment for something on taping versus bracing for an
Yeah,
ankle.
yeah,
And it seemed like at the time back then that the effectiveness was the same. So it was
yeah,
no better tape or brace.
yep,
And I'll often tell that to the boys at review, like if you just for time and also cost, grab a brace for
yep,
training is a good option. And we can always tape for
yeah,
games because it's more comfortable, especially in a kicking sport because it
yeah,
moves a
yeah,
little bit more and it's
and
not as
also
rigid.
breakdown on the skin. At the end of the day, it's glue. you,
Yeah.
you really don't want to be putting it on you for weeks on end, because it will start to draw moisture out of the skin. You'll start to get irritation. So if you're going to use it long term on your
And
skin,
Yeah, and some people
brace
get
is
away
better.
with that. You
Yeah,
can
some
put
do.
Fixamol and stuff underneath,
Correct.
and they get away with it, or even the padding
Yeah, the
bandage
foam
underneath
wrapping
the
they got
foam
now.
wrap
Yeah,
stuff. That works well, but it's not going to prevent the injury reoccurring or an injury happening in the first place. Putting
no.
tape on an ankle or a shoulder or something like that, it may be reducing the risk. I think there's a difference there.
Yeah,
We're reducing the risk slightly, and I'll often say to netballers or basketballers that play a sport where there's a lot of feet in a small space that there is a high chance that you may land on someone's foot, and it's kind of like you're landing on a rock. and the chance of you having a ankle sprain from that position is high. So if you put a tape or brace on, if you've previously had an injury to the ankle, it may be reducing your risk of further injury, and it just makes sense. So a lot of the
Yeah.
recurrent ones over the years, I've been like, well, you may as well just have a
Yeah.
brace with you at training. Then
Yeah.
you don't have to worry. The good thing about a brace is you don't have to worry about the quality of the taping job, and you
Yeah.
don't have to worry about having a physio there or something like that, because
Yeah.
it is very hard to tape your own
It
ankle.
is. Yeah.
Even if you know how to tape an ankle really well, like we do, it's hard to get the angles right
Yeah.
because you're so
Exactly
far
right.
away from your hands are far away
100%.
from your feet.
Yep.
So
Well,
that's probably the way I'd typically put it to an
well, even
athlete.
personally, when you played sport growing up, right? I know for me, running out every weekend in the footy, my ankles were taped, regardless injury or not.
Mm,
It was a purely psychological thing. It was probably part of my mental preparation pre-game. I'd go to the physio.
yeah,
You know, I'd just say, "What do you want done?" I'll do both my ankles. Oh, did you injure it? No, just do my ankles.
yeah, yeah.
And it was part of it. I've never had recurrent ankle injuries. It was just part of my mental process every week. Then I'd get my shoulders done going into play,
And
fullback.
and did you get your shoulders done because you'd had a previous injury?
No, not at all. I didn't
No.
tackle. What do I need to worry about?
But at the
But it
same
was,
time, you rarely see people taping their shoulder as a
yeah,
precaution. Like
no,
they're not having
correct.
precautionary taping on a shoulder. But you'll see sometimes precautionary ankle taping
Yes.
in netball, basketball,
Yeah. I think mine
whatever it is.
was probably, I never injured. I injured my shoulder badly after school, but at school it was always just taping it, and it was a mental thing. They felt more stable. I'd
Yeah.
grown up playing with shoulder pads. Got to the first lot of rugby, and the first and shoulder pads were no longer cool. So you take your shoulder pads off, and so what would you do? You'd tape your shoulders. So I
Needed to put
think,
some muscle on.
mate, back then I did.
Yeah. You're skinny.
Yes, I am now too.
What are you down to?
Horrible. No, now 90, but it's just everyone coming in at the moment's asking me if I'm sick.
Well, that's not what you want to hear.
No, it's horrible, mate.
That's exactly the opposite of what you want to
Like,
hear.
it's horrible.
No, I hear you.
Anyway,
I hear you. I've always been a skinny type, mate. I get
yeah,
you.
no. So, like from that point of view, though, psychologically, I think there's a value to taping
Oh
as
yeah,
part
for
of your
sure.
mental preparation. Um, again, I agree with you. Are we preventing an injury? No. Reducing the risk? Yes. Also, does it give that person that sense of, reassurance with their injury that we're taping them? Again, yeah. And if that takes them to full or their best performance that we're going to get post injury, then taping's an effective method to use.
Yeah. And after a dislocation of the shoulder or an ankle injury, people may want to brace for a 6 week period, 8 week
Yep.
period, 10 week period. And then from there, they feel like they're confident enough that they don't want to. But I
Yep.
think it's maybe a little bit different in those games where there's heaps of feet in a small space.
Yeah.
Netball and basketball and stuff, where they're
Yeah.
going up for layups or they're
Yeah.
jumping and landing regularly, and you could easily land on someone's foot.
Mm.
Like there's a fair few tennis players over the years that have gone through their whole career wearing ankle guards or braces,
Yep.
such as Leighton Hewitt wore them for
Yep.
many years. I saw Alexander Zverev had ankle surgery last year, the German, and he's come back and he's wearing an ankle brace.
Right.
So yeah, I think it's case dependent. But I agree that the psychological effect of putting tape on
Yeah.
definitely helps people. And I hurt my ankle sort of 2012, was it? And I remember taping it after, and it definitely made me feel more confident.
Yeah. And it's
Um,
the same, right? I don't know your protocol, but if we ever have someone in a cam boot for whatever reason, the next step from weaning out of a cam boot can often be a brace or taping.
yeah,
You,
yeah.
you know, and it just is it as good as a cam boot? Like fuck no. Like obviously
Yeah.
a cam boot is a rigid structure that completely offloads what we're trying to do. And taping can again just be that next little step down to make someone more confident walking without a boot for whatever reason they've been in there.
You're kind of weaning them off it.
Exactly right.
Yeah, yeah,
So,
yeah.
are you against it? No. Would I? And I don't know. Like, what's the opinions on people? Do you reckon is it like a solid yes to use taping and a solid no, or are we all sort of just use it when we want to?
I just use it as needed.
Yeah.
some games of footy, some of the boys will be like, "Oh, can you take my thumb?" And I'll ask them, like why? And oh, I just want to take my thumb today. But then the following week they don't ask,
Yeah, yeah,
and it's not like they've injured their thumb the weeks before. And personally, I had a few thumb injuries as a junior footballer in AFL, and from about the age of 10 or 11, and I take my thumbs, both of them, every
mm.
single game for the rest of my career
Yeah, right.
and trainings.
Yeah,
So I used to always have in my kit bag, I'd always have my thumb taping, and I'd do my thumb
yeah,
taping, and but I always felt more confident and comfortable taking a mark
yeah,
with that tape on. Obviously in AFL, you get taught to take a mark like that where
yeah.
your thumbs are kind of together and you're splaying your fingers out. So it just felt more comfortable doing
Yeah,
that.
right. Maybe you would have been better at not taking so many marks, though. You might have led to less concussions in your career, hey?
Well, a couple of the big concussions that I had, well,
You're
were
up in the
taking,
air.
yeah, taking a big mark and then coming down. Like the last one I had, 2008, our first year of uni, when I had to retire
I
from
think I
footy.
might have said you were playing for North Aubrey, weren't you, at the time or something?
North Albury at the
Yeah, I
time,
remember I actually watched that one randomly.
playing at Albury, and
Mm,
took a mark, was having a good game, took a mark, and I came down. I don't remember it obviously, but the
mm.
footage was there and came down, and I think my head collected someone's hip or knee
Yeah,
because I kind of came down more horizontally. So
yeah,
yeah, maybe
yeah,
I should
right.
have stayed on the ground a bit more,
I'll
but
make
still
sure
playing.
I won't take my son's thumbs up then. He's just started playing at his first game, or first training session on last Saturday.
AFL,
Yeah,
what are you doing?
yeah, no, they don't
You
do
come to
junior
the
rugby
dark
league.
side.
I know, I know.
What is going on? This is
Look,
great.
let's be honest. He's a bit soft for that boy. So, no, no, they are. So he's only 2.5, but
All right.
he's in a little like it's a youth AFL academy that they're running.
Brilliant. This
And
is
no,
why
it's
AFL are killing it.
mate, it's brilliant. Like it's the only place they're learning how to mark, kick, handball, tackle. Like he's mate, he loved it. First thing, he absolutely loved it.
This is why rugby
And
union need
then
to take a leaf out of the AFL's
yeah, and
book
he'll
because
follow. He'll probably play AFL now because all his friends that he's meeting there, he'll end up liking the game, and he'll follow, like I'm not going to tell him what he can play or can't play.
yeah,
So
exactly.
he'll end up playing probably AFL in for East or something like that.
That's great news.
Yeah,
Well, the AFL have killed it with the Auskick program. I
yeah,
did Auskick
yeah,
back in the day, so that would have been, I don't know, 1992,
yeah,
something like that. So Auskick's been around so long, and you wonder why they're absolutely killing it, the AFL, with the expansion and everything now down to
yeah,
Tasmania and Northern Territory one aside, and
yeah.
it's the superior code, mate.
Oh yeah, I mean, it's arguable. Um, so where were we? We said we'd get sidetracked, didn't we? Taping was such a boring topic that we'd get sidetracked so quickly.
It was better than I thought it'd be,
Yeah,
a taping topic.
yeah. Well, I think look, a lot of people have asked on it, and I probably one of the questions I got was when I use it for acute injuries. And like I was thinking about it, and I use it very seldomly, but I had one the other day, an incredibly acute lower back, and it was disky, and every movement was painful. Sitting, standing, bending, like it didn't matter. It was incredibly acute. So I did the very simple X bracing across the back, and yet, and he came back in actually today, and was very happy. But it was probably the thing I didn't want is that he said, "Oh, mate, as soon as I took the tape off, I felt like my back was going to go." So again, it's that downside of it. It probably gave him that reassurance, and I was able to get him doing what he wanted to do. But then the minute that tape comes off, he feels like his back's weak. But mate, what was
Yeah.
the tape doing? And I don't think it was doing anything like he thought it was.
Yeah, you're getting a slight neurological change via the diffuse noxus inhibitory
Mm.
control. So pretty much what that is for the listeners is kind of like a distraction for the brain. So a good example
Yeah.
is say massage or acupuncture or whatever it is. That's distracting the brain from the original signal, or tape as well. The tape being on the skin is distracting it from the original signaling. So a good example I often give patients when I do some taping in an acute stage
Yeah.
is I will say, we're not changing anything structurally here. We're just giving you a little bit of confidence so you can move. And it's like a kick in the shin. if I kick you in the shin really hard and your back hurts, your back probably doesn't hurt as much now because your shin hurts.
Yeah.
So that tape is giving your brain a bit more input.
Yeah.
So that's
Essentially
a nice.
overriding signals.
Correct. Yeah, that's a
Yeah.
good way to put it often. So I think if you've got a good narrative around why you're taping, I think it's fine. Go for it.
Yeah.
But if the narrative is this is holding you together and this is
Yeah.
protecting you and this is going to 100% reduce your risk of injury and prevent you ever getting injured again, well, the narrative is incorrect.
Yeah. Yeah,
Yeah.
exactly right. But it is one of those funny ones, right? So, I mean, in an acute setting like that, again, probably like you, we use it when we want to use it, don't use it when we, like I've seen however many backs this year and maybe taped 1 or 10% of them, or, I wouldn't even know. So, when you do it, it's probably one of those ones you judge case by case, symptom by symptom.
Mm.
What do you want the person doing? This guy was a plumber. So, some of the positions they're in, did it let him do his work because he works for himself, couldn't stop working. So, case by case, would I do it to an office worker who's sitting all day? Probably not.
Yeah. And I think if you did tape them the first session, that's fine
Yeah.
for an acute back or something like that. But I would try and wean them off as soon as
Oh,
possible
yeah,
so they
absolutely.
realize that they're strong, resilient, and they can keep
Yeah.
going with their day-to-day stuff. So
Yeah.
probably the first session's the only time you would do it.
Yeah, exactly right.
It's because it can get to that point where they overreact and it becomes a dependence and they even buy a back brace or something like that. And, it's like, it's like transitioning from alcohol to drugs or something like that.
Yeah.
They're transitioning from tape to a
Yeah,
brace.
exactly
So,
right.
um,
Which is what we
uh,
don't want.
no, exactly. Yeah. We
Yeah.
want to empower people to continue to move and
Yeah.
realize that they're strong and resilient.
Yeah, exactly right. All right. Well, I think we've touched on everything, Wally?
I think so. Yeah. I think
Yeah.
that we'll tick the tape off.
Yeah.
I think that's all we really need to touch on. Is there anything
Tick the
else you
tape.
wanted to go through today?
No, I don't think so. I think there's been a couple of requests, which we'll do on another podcast for some, return to performance, return to sport, sort of, like a topic. I know we did one far out, going back ages when we did it up at Bondi Junction in the studio. We did
We
a
did.
return to
I
sport
think that
or
was
something.
the third episode, was it, or
Yeah,
something
it
like
was
that?
it was maybe a core training one or a return. I can't remember. We did do one,
Yeah. Yeah.
but a lot of people have been asking for something going back down there and touching on how we might go through as a return to sport. So maybe we'll sort of like do a little bit of a case study
Yeah.
type thing on that. That's where a lot of people are asking, how do you apply? How do you know when to do this exercise and that exercise? Maybe we might go into that next time. Maybe some people will give us some feedback via our Instagram,
Yeah.
what they want.
Yeah. Sounds like a plan. I think that's a good idea.
Yeah,
But I think for today, we'll leave it there.
mate, I'm pretty happy with that.
Let's do it.
Done.